Spinal health. That's what we're all about today. So what is your spine? Your spine is a column made up of 33 bones. Each bone is called a vertebra, and there's 24 of these vertebrae that we're actually concerned with here in terms of movement, because there's only 24 that are actually capable of movement. And in between each of these bones, we have our discs, our cartilaginous discs that help distribute load and force throughout our spine so that we don't wreck ourselves. And in order to get proper hydration, nutrition, keep these discs healthy, they require movement. It's one of the very few ways they actually get blood supply and keep themselves hydrated. So that's what we're going to do here, is we're going to move. And in this first video, we're just going to utilize two simple movements of flexing our spine and extending our spine. And if you've ever taken Pilates or yoga or another movement practice that incorporates this, it may sound similar to cat-cow, cat-camel, and if none of that means anything to you, it's perfectly fine. Just follow along, and you will understand shortly. All right? So to start out, you're going to position your hands underneath your shoulders and your knees underneath your hips. Start by pressing the ground away from you and fully rounding your spine into flexion. And we're going to start with our tailbone, and we're going to work our way up. We're going to tilt our pelvis down towards the floor as we start to extend our low back, working all the way up through our mid-back and our neck, maintaining that press against the ground to keep our shoulder blades active. And then we're going to start with the neck and reverse, tucking our chin, pressing our upper back away, and eventually tucking our pelvis underneath. And then slowly reversing, again trying to feel motion in between each individual segment of your spine here. And once you get up towards your neck, really try to maintain length in that spine and don't just allow yourself to dump into one section as you look upwards and forwards. And again, going slow with intent as you reverse the direction into flexion. Making sure that your hips aren't just shooting backwards. And again, you're not dropping in between your shoulder blades rather than moving through your spine here. And you can even start going into flexion, starting with your lower back as opposed to your neck, and feel for the difference in movement there. And just noticing how it feels.